With me in the studio today, Dr. Elijah Saikaly from Orleans Orthodontics, OrleansOrthodontics.com, the website. He's come here to talk today about braces, orthodontics in general, and a new product that they have, Invisalign, which to me is a lifesaver. Doctor, welcome to the show today. Good to see you.
Good to see you. Thank you so much.
Invisalign is one of those products that I wish they had when I was younger. The interesting thing is I could use them today to straighten out those teeth that my parents wanted to do 40-odd years ago.
It's never too late, Norm, never too late.
Let's talk about Invisalign specifically for a while, for a bit yet, because you know, this is a product that is clear, it's unnoticeable. Tell me a bit about the concept behind it.
So the concept about Invisalign was, you know, a lot of adults were trying to find alternatives to traditional metal braces. So on the market for about 30 years they've had ceramic braces which are clear. There's still limitations with ceramic brackets, the technical term for braces. You'll see the wire, and there's still that profile issue with braces. They do stick out, they're about 3 to 4 millimeters, so in terms of comfort compared to Invisalign, you know, braces will always be next in line. So Invisalign was invented back in 1999, so it has a pretty good track record. There's between Canada, the United States, and some of the other countries that Invisalign is available, there's over 1 million patients that have been treated. So the history is there, even though it's such a new product on the market. The real benefits with Invisalign is that they're removable. Okay. Yes, they are absolutely clear, or very clear, from about 2 to 3 feet, Norm. You can't tell somebody's wearing Invisalign. Whereas braces, you know, you can kind of see it around the corner coming your way.
Especially if you're standing in the sun, yes.
Absolutely, absolutely. So one of the big benefits, like I had mentioned, was that they're removable. And why that's so important for patients going through orthodontic treatment is there's no limitations on what you can eat. So you can take the Invisalign out, have pizza crust, tortilla chips, hard candy, cashews, almonds, you name anything that's hard. I know some people like to chew on ice over the summertime. Yeah. You know, it's
not a good thing, but yeah, it's done.
Well, it happens. It happens if you have a pregnant wife.
Yeah.
You know, it's very common. So that's one of the big things. The other thing about being removable is your oral hygiene is not impeded. So with braces, it's a little bit tricky to brush around the braces, to floss around the braces. Just the day-to-day maintenance of your teeth throughout your orthodontic treatment with braces is a little bit more work. With Invisalign, you remove them, you eat your lunch, you eat your supper, you brush and floss normally, and then you just reinsert them.
Now, of course, the idea behind orthodontic work is to bring the teeth into proper alignment in the jaw, make sure that the bite is perfect, you know, that there are no issues with crowding or things like that. And we, you know, when you see the braces in and you hear of people going for adjustments, they, you know, they start tightening them up a little or loosening them up a little or whatever needs to be done to get to the program. What is it with Invisalign that makes it do the same thing?
So what Invisalign, the way it works is it's once the initial model of the tooth or the teeth and the jaw relationship are established, it's actually a computer software that gradually aligns the teeth from, let's say, from A to Z over a series of trays. And here I have the series of trays, if you can imagine. So each tray is worn for 2 weeks, and what the computer does is it takes the treatment from A to Z and it breaks it down in manageable increments that tooth movement occurs. So let's say, for example, it's 1/4 of a millimeter per tray. So if your teeth need to go 2 millimeters, that would be 8 trays of treatment. And that's just an approximation. Yeah. So, you know, the typical treatments can vary from 6 months all the way up till 2 years, 2.5 years for Invisalign. And what is nice about it is that once the computer and all the work is done technically online and we order the trays, we basically have the person's treatment. With braces, it's a little different. Every time they come in, the orthodontist has to make the adjustment, see what's going on, either bend the wire or, you know, there's the fine work. So what's happened is a lot of the technology has taken over, much like many other industries, and it's working to our advantage where we can get from A to Z, computer programmed, a lot better with a computer than a lot of times manually. The only thing with Invisalign is with more complicated cases, sometimes Invisalign it's beyond its scope. So Norm, what we do in those cases is we do a combination treatment where, let's say we do 6 months of braces and then we switch them over to Invisalign. So instead of having 2 years of braces or 3 years of braces, we can cut that time down for you.
Yeah. So essentially what you do is you get a computerized image of the patient's mouth, you determine what the end result should be, and the computer's the one that essentially draws, it's almost like a computer-aided design, draws the way the Invisalign mouthpieces have to look over that series of treatments.
Exactly.
Fascinating stuff.
It's quite incredible. To be honest with you, to me, Invisalign is the future of orthodontics, and it may not happen in my lifetime, but I think eventually, braces will be a thing of the past for the number of reasons that I've already mentioned.
Yeah, and with some of the emotional issues my friends had when I was younger about braces, boy, that can't be anything but a good thing.
Absolutely. The best time to see an orthodontist, believe it or not, which is recommended by the Canadian Association of Orthodontists, is at the age 7. Okay? A lot of people think that's a little too early to see an orthodontist, but what happens is typically around age 7, the front teeth start to erupt. You'll see the children at 7, the front teeth will become loose, and the adult teeth are starting to erupt, to come in. So what we want to do is make sure that, first of all, they're erupting in the right sequence, they're erupting in the right spots, okay, and they're erupting at the right times. So sometimes if a tooth erupts or falls out too soon or too late, it can off balance the rest of the teeth that are to erupt. So sometimes it's a good idea to book a consultation with an orthodontist when you see the front teeth, the adult teeth start to erupt. So to answer your question, 13 is definitely not too early. A lot of times if everything's developing properly, what we do is we place them on a 3, 6, or maybe a 12-month recall. So that way the orthodontist is following and somebody's keeping an eye on the big picture. And what I always tell my patients is, with my colleagues, my friends, the dentists, they're paying attention to all the little details of each tooth, the fillings, stains, cavities, etc. But the orthodontist, we're monitoring that the jaws are growing properly and that the teeth are all coming in at the right time. And typically at age 12, okay, plus or minus a year, some children are a little early, some are a little late, we should see all adult teeth at 12, okay?
Now, if your niece has some sort of orthodontic issues here, I'm assuming you're wondering if it's too early to get actual braces at 13 as well? How about that? 13 braces?
So, yeah, very good question. A lot of times treatment, there's 2 different types of treatments. Sometimes it's a complete treatment, and what we do for complete treatments is we wait till all the adult teeth come in, which is typically at 12. And at times we need to do limited treatment, perhaps widen the upper jaw or just a couple of braces to make room for another tooth that's coming in.
Oh, okay.
So at times you'll see, and a lot of patients come in and say, well, my friend's daughter has braces and she's only 9. So it's very difficult to compare each child, but sometimes we do a limited treatment just to prevent future problems down the road. So it could be just maybe 6 months of 7 braces on one side of the teeth or just the front teeth. The question about is it too late? To be honest with you, I have patients in my clinic that have orthodontic treatment and they are 60 years old. So with teeth, so long as the ligament that holds the tooth to the bone is still in good shape and there's not too many other health issues, related issues, it's never too late to have your teeth straight. My biggest demographic in my practice right now is 30-year-old patients, much like Norm. I'm not saying he's 30. I'm just saying sometimes some patients.
I'm older. Let's put it that way.
A little bit older, 33. A lot of times, some patients, they didn't have the opportunity when they were younger, or they put up a struggle with their parents, and it's something that's been on their to-do list, their bucket list, if you will, for quite a long time. And there's something to be said about a nice smile. And if you do have friends that are in orthodontic treatment, talk to them the week their Invisalign is done or their braces come off, and they'll tell you that it was a positive experience and it was well worth the time and energy spent.